I'm Dr. Simon Rosenberg, the high-tech dentist. And some people have said a laser is a laser is a laser. Well, there are different types. You're probably most familiar with when you go to a lecture and somebody has a pointer, and that's a laser. And you'll notice that most of them initially were red, and then as they developed other colors. Lasers are a single light frequency, and depending on the frequency, different tissues, when we use it biologically, will absorb the different colors, if you will, of light. Visible light is only about this much of the spectrum. On one side is the ultraviolet, and it goes on to microwaves, and on the other side we have the infrared. Most dental lasers and biological lasers are in the red, near red, or far infrared. The iPlus is at a very long wavelength, the far infrared, and it has absorption in the area of water, so that we're able to energize water through a photodynamic action. It basically instantaneously heats the little drops of water, causes them just like popcorn to explode, and that's able to dissolve tissue. In contrast, we find that the 940 nanometer diode laser, which has been recently upgraded in the form of the EZlase, gives us the ability to do some other things. Number one, the absorption is with pigmented tissue, and so if we have a small bleeder that is not stopped by the coagulation of the iPlus, we can just pick up a small handpiece and touch the area that's bleeding and it will stop. But one of the most exciting things now is the use of biostimulation. You can go on to the internet, just look up low light laser therapy. You can even just put in LLLT, and you'll find both articles in scientific journals as well as videos explaining low light laser therapy. How do we use it here? We're using it in almost every surgical case where we're able to stimulate the tissue. We're using it also with TMJ, and with a slightly different wand we're able to use that same energy level to activate a special gel for bleaching the teeth. This happens to be the wand where we're using it for either biostimulation in an extraction site, an implant placement site, or to reduce pain after a root canal. And it's too early for me to tell, but we're also using it with some of the orthodontic patients. The research basically shows that the light is able to knock off the nitric oxide molecule off of the mitochondria. This causes the mitochondria to speed up a bit to produce more ATP, the energy medium, chemical energy source. The natural energy source of cells is produced in the mitochondria, where ADP, adenosine diphosphate, is converted to ATP, and that's needed for all activity, but particularly for healing. The interesting thing is it also cuts down on the inflammatory response, and so in the case of an extraction site, an implant placement, or a root canal, just using at a much lower level 3 watts of power, about 100 joules buccally and 100 joules lingually, we find that pain is much reduced, and it appears that the areas heal much more quickly. In the case of TMJ, because we're going through skin, we're able to again warm the muscles, probably cut down on inflammation using about 7 watts, and depending on the muscle group we use anywhere between 3 and 700 joules. on each side, and patients do report a reduction of pain when it comes to temporal mandibular joint dysfunction and pain from bruxism and clenching. So we again at arm's length. This is generally kept behind me. This is kept right in front of me next to the other dental handpieces. We're able to provide both a cutting environment, a healing environment with the special tissue results of iPlus, and we're able to utilize EZlase for low-level laser therapy, hemostasis, and some other soft tissue procedures.